Specifically, we heard that there was a huge spike in the cases recorded in China yesterday. Now, that has to do with the changes about how the disease is diagnosed, but that didn't reflect in the number of cases in Europe. That there was no spike. At the moment, there's around 44 cases confirmed in Europe. The highest number of cases is in Germany. It's 16, 11 in France and 9 in the UK, 3 in Italy. So certainly that hasn't changed. And also we heard from Dr. Michael Ryan from the WHO yesterday in a press conference where he said the profile of those people that are dying from the coronavirus remains the same, which is people who are quite elderly and also people who had underlying health conditions. It was a meeting to discuss how to essentially, or when eventually it could be said that the chains of transmission can be broken, and that's sort of nowhere near in sight. So there was a consensus really that, the most important thing for member states to do is communicate factual information in a timely fashion around best practice, around the numbers of people who are being diagnosed, numbers of people who are in quarantine. We should also say as well today, Rosie, that 181 people from France have been released from quarantine, none of which were said to have had the coronavirus, and they were brought back from Wuhan, the epicenter of the case. So again, from a European perspective, really things are at preparatory level, and the threat of sort of an all-out outbreak remains quite low to moderate. Each different member state, each different country has its own vulnerabilities and exposures. Like I said, the country with the most cases in Germany, for example, in Italy, there's 3 cases, and the Italians have made very significant changes. For example, they've ended all flights to mainland China, the only country to do so. They've also started testing people at airports. The head of the Emergency Operations Committee there said they might start testing people in train stations. In Germany, where they have the most cases, the health authorities say there's no point in doing that. It's only a veneer of actually action, that you don't get any proper results from testing people in airports, etc. So there really is no consensus, but there's been quite a large impact on in terms of the economies, particularly in countries like Italy, which has a huge fashion industry, where you have Chinese people spending a lot of money in there. We've also heard an impact on the London Fashion Week, where a lot of Chinese designers and Chinese manufacturers haven't been able to get goods to London. So there is a huge impact. But I think, as we said at the very start of this, because the number of diagnosed cases has been quite low, there hasn't been a consensus yet. It's more of like a wait and see.